Hey, good afternoon, good evening, and good morning because there are a lot of people who have joined from different cities across the globe. So, first of all, I would like to say thank you for joining our webinar and having interest in the health cloud. As we all know, health cloud is the main healthcare, especially for the healthcare domain, and it's the main cloud of Salesforce, which has been evolved in last 6 to 8 years, right? So before I get onto the health cloud of it, why there is a need for the health cloud? Especially, there are certain challenges and there are different opportunities, and that's the reason health cloud has been emerged. There are silo systems, especially in the healthcare system, when it comes to AMR, PHR systems, HIE, which is healthcare information exchange systems, right? Disparate customer views with regards to patients, with regards to the leads, with regards to the referrals, providers, payers, and the interaction which is happening is not a limit. There is a limited interaction which we are doing, and then activities which we are capturing. There are opportunities with regards to changing the experience of our prospect, changing the experience of our patients, and personalization is very much needed in the healthcare industry, and that's why we have Health Cloud. It's the combination of clinical and non-clinical customer data, which is directly or indirectly linked with healthcare industry, whether it's your pharma, whether it's your payer, whether it's your provider, all of them are linked under the umbrella of Health Cloud. Few of the, I would say, USPs or important points of Health Cloud. Definitely, it will lower your cost and improve the automations. It has artificial intelligence. It has a lot of automations and flows which you can implement, which can give you personalized health experience. Which you can give it to your patients, to your subscribers, and whether it's a health tech platform, whether it's a payer, which is payer means insurance companies, or the provider, which means hospitals, sole practitioners, nursing homes. Now, all these companies under healthcare will get benefited with the help of Health Cloud. We would be able to deliver care and services on a real-time basis. It is faster with regards to customization, configuration, because we all know that has been built on Salesforce platform. So it's definitely configurable. And it's a very secure platform, which is all the GDPR, HIPAA compliance being there, right? Now, so this is one of the screen I'm sure you would love to see this screen, because the middle layer, if you can look at the middle layer, now the middle layer is built of AI and analytics, which is nothing but your Tableau and artificial intelligence, Einstein. Now, there are a lot of modules we can implement and we have in our healthcare cloud or health cloud. It is appointment management. Whenever a patient comes in, they try and take the appointment of a doctor. Networking management, how each provider, which is each doctor, is linked with any other nurse in a nursing home as a sole practitioner, also giving a referrals to different labs, testing labs, also giving referrals to the bigger hospitals. So there is a network management also. The care management is nothing but your patient care, the member care, which you're providing. Services, the kind of services which patient is taking from a particular hospital. Utilization management, utilization of your resources, assets. Commercial sales, definitely B2B and B2C, and referral management, right? As I told you, the data model of Health Cloud is basically on the payer. Payer is again insurance companies, providers means sole practitioners, doctors, med tech companies like Preston Care of the world, and then pharmaceuticals, which can be your Dr. Reddy's, Bayer Heikel Labs, or you know, um, Aetna. Oh, sorry, not Aetna, but there are a lot of pharmaceutical companies who manufacture medicines. Now, the foundation of Health Cloud is definitely and definitely the sales management, which means the Sales Cloud, service management, care management is definitely the Service Cloud, and the platform, which is force.com, right? Now we call the complete charter. The complete charter can only be possible with the help of MuleSoft, which has pre-built APIs and connectors for integrating the same with the health information exchange, bigger ERP systems, right? Uh, Especially in the North America, we have EMR, PHRs, and then different like GEE. GE Healthcare has a different HI system, so those systems can be easily integrated with Salesforce Health Cloud. On the top layer, if I'll talk about the top layer, so there are members, patients, citizens, physicians, brokers, and partners. There are different personas which we can play that, for a med tech company, there are members. For a patient, the patient who is coming to your hospital, and then taking services from you, they are citizens. There are physicians, there are doctors, there are brokers who might be, giving some references and referrals, and partners. Partners is somebody who is definitely part of referral management, who is also giving, references, as well as, being partner under our hospital, being giving some sort of services of a healthcare industry under a particular hospital. So those can be different personas, member, patients, physicians, brokers, and partners. Now, if I move to the next one of it, now you will see that your personalization experience, your omni-channel engagement, your commercial excellence or health equity. Now, all these might be a bigger terms, but I'll go one by one. These modules are the kind of engagement or the experience which you are giving to your patients, which is personalization, or could be to your, let's say, doctors. So this personalized experience is more important, which been provided in the Health Cloud. Omni-channel engagement means you would be able to reach out to your patients through different mode of channels, which can be your WhatsApp, which can be your email, can be a phone, or some other social channels which you want to use. Definitely, it has Sales Cloud, so there will be a part of commercial excellence, automated workflows, flows which you can automate, and we can bring a lot of value with regards to automation. And the human intervention can be removed. A lot of things which you can do in the Health Cloud. Digital collaboration means like digitally we are the network of healthcare, a patient, let's say a particular lead which will come to a particular doctor will be connected with a pharmaceutical company. Then the pharmaceutical company will be connected to a particular test lab, and a test lab might be connected to a bigger hospital. And bigger hospital, there are different type of physicians there, and they might be connected with a pharmaceutical company later on. So pharma labs. So there are it's a mesh, it's a network basically of a healthcare industry, and that's a single view of your view will when you will be using Health Cloud as a hospital. You will have a single view of your consumers, your members, your patients, your providers, and definitely your partners. Now, the data will be flowing from Health Cloud to different systems. Now, EHR, electronic health record. ERP, you would be having an ERP system where you will be doing all the billing, and your product inventory would be there as well. Your insurance, which is claims, can be done. So there is a different system, where you can do your e-claims also. Your wearable data, your devices, your machines would be there. Then your clearing houses, and then last but not the least is a bi-directional integration with your pharmacy companies also. We call that e-prescription also. So think from the perspective, see, we are in India, and we see health cloud. How you might be thinking, how a particular pharmacy, a local shop of a pharmacy which is there in our local city, how that will be connected on health cloud. The answer here is this whole product been developed considering the healthcare industry of US. Now, in US, there is e-prescription also. So a doctor is writing an e-prescription. You can go to the particular pharmacy, and then the pharmacy will have the e-prescription already. And while looking at the e-prescription, you are not carrying any prescription, any hard copy of the prescription. Pharmacy labs will definitely have, and they will give it to you, let's say 5 days of doses. Now, the 5 days of doses, which you might be getting, those doses, if you want like another 5 days to be there, you can go to pharmacy, and the pharmacy will not give it to you. They need to send a request to the doctor. The doctor has to get it approved, and as soon as it'll get approved, obviously, they will be able to give another dose for the another 5 days. So that's called as e-prescription. Now I move to the next slide of it. Whenever we come across any healthcare or banking domain software, the first thing is regulatory, compliances, trust. As Health Cloud is built on Salesforce platform, so definitely the trusted platform. There are different accreditations, there are different compliances which Health Cloud has, which is HIPAA compliant. They are your GDPR, ASIP, or IRAP. Then there are verified electronic records, HL7, FHIR, a lot of healthcare compliances are already been approved and stamped. So you are in any city of the world, you would be able to keep your data safe under Health Cloud. So if any of a customer is using is in the healthcare domain, you can definitely advise them to use Health Cloud to take care of their patients, to be part of that healthcare industry network, and without even thinking about the regulatory and compliances of the same. Yeah. Now the question is how health customers are lowering cost and building the trust, basically. So let me just go to my next screen of it. Now so we have taken certain examples as medtech companies, as a pharma company, as a payer, as a public relation company, as a public health company, from different cities and different locations who've been using Health Cloud of Salesforce. Example, the first one, MIT Healthcare, which is a provider, which is a kind of a hospital where they are using Health Cloud to making patient experience better, and operations, best of the best operations. Now, after using the Health Cloud, they have increased 30% operational efficiency, which means things which were they were I mean, there could be a possibility that errors might come into those operations. There is a little delay in that operations. Now, they have increased their operational efficiency by 30%, 9+ day reduction in the procedure scheduling time. So it means this is a wow factor of using Health Cloud, because if a particular patient procedure scheduling time can be reduced 9+ day. This is amazing. And I'm sure that's the ROI, return of investment, which been done on Health Cloud. Now, if I'll take an example for a payer, which is nothing but an insurance company, Horizon, which means the value-based member care management, where member care management. So they have 400+ hours saved annually per full-time resource, improved high-risk members, outcomes of the high-risk members as well, which whosoever has taken a patient has taken an insurance. Now they've been using Health Cloud for managing their patients as well, who are taking e-claims from Horizon. Now, let's take an example for a medtech company where a medical technology-based platform where medical devices and medical things are there. Now, digital engagement and workflow automation. So they have digitalized the complete e-commerce. Now, there the 10% of chat support volume deflected, which means that they've been answering those questions more accurately, right? How the bots have been there. Omni-channel patient care has been given. So if somebody wants to connect with you, with I would say through WhatsApp. So you are being connected through WhatsApp only. If somebody is more interested in around up for a call, then call would be an option. Then if somebody is very much interested for having an email reply or being connected through an email, so that kind of a omni-channel presence which we are giving to our clients with regards to Smile Direct Club, which is a medtech company. Novartis Pharma, where the patient care and program engagement is through Health Cloud. And then the last is a public health company where the multi-clinic vaccine management been taken care on the Health Cloud of it. Not only these five, but there are many trailblazers where who are helping on the health ground to different patients, payers, providers globally, and they've been using Health Cloud, and that's how Health Cloud has been emerged so far. Year and year, every year there are a lot of features which gets populated or which gets released every year. Within the 3 releases, this Health Cloud has maximum releases also, and I would say it's faster time to value now. For the investment which we are doing. For more details, go to healthcloud.com and just check that as well. Some more examples I really want to give it to you with regards to the Health Cloud features. Now, first time experience of your interactions with your patients, with your leads, with your customers, with clinical trials, with pharma companies and all that stuff. So be it a provider, payer, insurance companies, or your edtech companies, so they've been giving first health experience, first interaction right. So I would say it's a trusted interaction where 360-degree view of your customer slash patients been given on a single screen. And then a guided path. Guided path is also been given where what would be the next best action to be taken care as a next step on a particular case, on a particular lead. Those things will be AI driven and definitely can influence the right outcomes also. Now, it also strengthen the provider relationship. which means a doctor's relationship with a detailed of each physician's complete directory over there from all in one place, everything at a one place itself. So on the right hand side, you can see the Health Cloud console. I'll be showing you in the demo itself, and the relationship of the provider, which is nothing but a doctor experience. Now you can provide the care wherever you might be, whether you're remote monitoring, you want remote monitoring to be done. One of the hospital is using the Health Cloud for providing the video chats so that the patients can be seen on videos if they're not able to travel to a particular clinic. Now, when I'm saying right care from anywhere means a connected journey, a connected data would be there. Um, then you will be able to raise your complaints or issues and where which care plan you are into, and then you can improve the outcomes. You can also, I would say, yeah, the efficiency at the back end, where the call center is, efficiency will be increased because some of them will be a self-service through the chatbot, scheduling, of a doctor appointment at home, at clinic, and a single dashboard view will be there where the appointments can be booked, scheduling can be done, omni-channel presence for patients to reach out to you, and then a bot will be able to answer a lot. So that most of the chats should not be, as I told you, if a bot is answering, then obviously the chat would not be reflecting on a chat window for an agent. Human doesn't have to get into it because the bots are giving all the answers. There's an automation on the processes. Very, very, very important aspect of Salesforce Health Cloud, where you can automate the complete processes. Why automation is easy in Salesforce, as we know, that is 90% clicks and 10% coding required. So it's all configurable, and multi-step workflows can be created easily, which can improve the overall efficiency of a particular process, whether it's a case management or a care management or a particular product or a particular service which we are giving to the patient. We can also standardize our processes, a network management, how each payer or a provider been linked under that network. And we can also automate the manual data entry and the document management in the Health Cloud of Salesforce. Now we can basically, I personally always call it a industry fourth revolution, and or anything which you require think of, Salesforce will have that, and that is always in our I would say Salesforce platform as a compliances. It's a trusted platform, no code tool. It's a low code, no code. It's a artificial intelligence is part of it. There is an app exchange of Salesforce where you can just type in healthcare and life sciences. You will see a lot of applications which can be easily integrated with Salesforce Health Cloud. And with that, Health Cloud become a lot of daily routine apps which you need. You do not have to create or customize Health Cloud. Rather, those will be available for you the way you want. And some of them could be free, some of them would be chargeable, and based on your need, you would be able to use those applications as well. Okay. The next is integration. So any CRM standalone will not make any sense for any company, because the CRM has to be integrated with your health apps. When I'm talking about Health Cloud, whether you want to connect with Apple Health, you want to connect with Fitbit, You want to connect with your lab machines, which is doing your MRI or something. So a lot of labs are on Lab Vantage, Allscripts, so Connors, Epic. These are, any ERP system at the back end, any clinical trial systems at the back end, those will be easily integrated with the help of MuleSoft layers. Now, you can connect and make a centralized experience where all your EHR, EMR, PHRs, EHIE systems will be integrated so that the call center agents will have a single record, single 360-degree view. And you can extend with this integration, you can extend your patient care anywhere or everywhere, I would say. You can combine all your clinical and non-clinical systems into one application and track your patient's health, patient's care processes or patient care plan. Also, in-person visits the patient is having, or the telehealth, that's another term which I can use, or the IoT devices. Yeah. Now, one more aspect is Health Cloud has a lot of innovations. So I'll go just quickly read it for you because there is a three releases we do in Salesforce. We do three releases in a year, and it's always speed, time to value. It's a trusted platform, which we all know, in a complete partner ecosystem. Now, not in our health cloud, I'll go one by one. It's a patient profile you can have your household mapping with each patients under a family. There will be a father, there will be mother, there will be grandparents and the kids. So you can have your household mapping under that. Your health timeline, when you get your test done, when was the last when was the last in I would say routine checkup was done. Social uh, social difference is where you will be connected with your patients socially on a Fitbits, or an Apple Health. Then your intelligent app management, which will give you more intelligence around that patients, around that provider, around that medicine. Then some assessments can be done. Your patient portal can be provided, your care plan, which is your insurance plans, your care team map. Then your gaps in that medication management would come. Remote monitoring of a patient can be done through Fitbit. Again, referral management from one provider to another provider. Clinical program management, your inventory management of consumables and non-consumables. Intelligent sales, where B2B and B2C sales can be done. Utilization management, how much we are utilizing our beds, a particular hospital in the beds I'm talking about, how much we are utilizing our machines for a particular lab, clinical lab, how much we're utilizing our providers, which is doctors. So provider network management, amazing module. So where your how each provider, how each doctor is linked, because a doctor will be on his or her own clinic as a sole practitioner. However, if the doctor is also having some specialized hours, on a particular hospital, or been working as an advisory member for a particular pharma company and helping them. So you would know that this doctor is being connected with different I would say services. A network is the mesh is like you need to know how efficient sales will be happening, because when you know your network, it's like kind of a LinkedIn network, if you'll say that. If you get to know that you want to reach out to somebody, then you try and on a first level connection, second level connection. That's how you would be able to see here as well. You then later on you have your intelligent automations. You need to connect your EHR or HIE system, and the scoring of your health. These are the add-ons, which you can have. But the bottom line is it's been built on sales and service. So definitely it will have a service part. Service is nothing but your cases, your complaints, your collaboration, your SLA and entitlements. You will have your knowledge management also. You have public knowledge management also. You have omni-channel presence through the service channels. However, in the Sales Cloud, again, there will be opportunities, there will be, lead scoring or quotations which you need to send it to different B2B customers. There will be sales contracts and account management. And the bottom line is, because it's a Lightning platform, so you will have Shield security, you will have app builder, you can have create different apps, you can have process builders, workflows, flows, trailheads, learning, analytics, and the app exchange integrations along with it. So this is the important slide. I will say, please take a picture of this slide because this is the most appropriate type of slide which can give you a one slide can give you all the complete glimpse of a health cloud, including the sales service and Lightning platform. I'm just taking a pause to see if you have any questions. I'm left with few slides. Okay, let me just complete that. Now, as I said, that there are certain consulting implementation service of healthcare of health cloud. Then there are life sciences applications which most of the partners have built on Salesforce, which will come under healthcare and life sciences. There are integration partners also. So different companies are working on to the same domain to help you onto the same. Now, healthcare CIM by class, which is one of the best, Health Cloud being named as one of the best leader in this category, and that to 5 years in a row. I'm talking about 2021. I'm sure it's in 2022 and 24 till 24 as well. Now, as I told you that it is important for providers, payers, pharma, medtech, and public health companies. So Health Cloud is for all, anyone who is under the domain of healthcare. It is beneficial for all of them. Especially for the India business, I would say a little bit you need to tweak your health cloud. Other than that, it's all good. And it's a little tweaking which could be required because we still not be able, I would say the US healthcare and India healthcare process is a little different. The terms and lingos which we use is a little different. However, the process still remains the same. And that's why I'm saying the little tweak could be required when we're using health cloud in India. So that's again same thing. I'm just giving a quick recap that you can have coordinate care from anywhere and streamline collaboration. Actionables can be done. Personalized delivery for the patient experiences. And by doing all that, definitely there will be increase in adherence to your care plan for providers, for doctors. Basically, the doctors can by using Health Cloud, they would be able to give a personalized care and personalized contact center reach. They can manage the other provider relationships and a coordinated care to their patients. And that's how they will have a single view of the patients, where contact and inquiry management, your patient administration, patient scheduling, pre and post visit activity management, and your patient experience, patient 360-degree collaborations. Now, if any of your provider is using Salesforce Health Cloud, it is basically for scaling up your patient success and providing services to your patients. That will involve not only patients and provider who's providing the services as a doctor, but there are different partners who will also be part of it. And hence, you will have the modules when if you are a doctor and you're using Health Cloud, these are the modules which will be available to you, whether it's a contact and inquiry management, your patient administration, your patient scheduling, your pre-post visits, and your patient experience. However, at the back end, this Salesforce Health Cloud will be integrated with your pharmacy so that e-prescription can be done. Your product inventory, which is in your ERP system, it could be GE or it could be someone else. You can also have your e-claims, which is through the insurance companies. You will also have devices, wearables, consumables, non-consumables, and EHR systems, which is for the appropriate for the clinical data and which will be going to the from coming from the labs. Now, a few of the examples, and as I gave you before, MIMIT Healthcare, who've been using it. So they have increased their ROI in just 3 months. Employee productivity, they've been using Marketing Cloud platform, Health Cloud analytics, and definitely the AI part of it. So that's major, uh, big case study, I would say. Then one more Pedimont Healthcare is again using Marketing Cloud, Health Cloud, and then Partner Community Analytics and MuleSoft and also using the Trailblazer community for learning. So this is a big case study where a lot of you can see the numbers which talks about the ROI which they bring in after using the Salesforce products. Then Innovi Health, so where 91% reduction in patient referral turnaround time, which means the turnaround time is pretty huge. And it's because they were disparate system, which will be consolidated, making a single data. And now they have single patient view, and all the systems are intelligently integrated, which avoids any leakage or being clear visibility of patients, electronic records of the patients to all the partner hospitals as well. Yes. Coming to Liftsburg, so again a personal senior care. So there is again they're also providing a care management to for for the seniors for the senior people. Um, I mean they've been using platform and health cloud both to take care of their patients. Then Everside Health is again their time was 2 weeks to 2 weeks only to market, which means they went live in 2 weeks and been integrated with the EHR systems. They are using Marketing Cloud, Health Cloud, Analytics, which is W, but Partner Community App Exchange as well, a couple of the apps from the App Exchange. And they've been helping employees through virtual screening as well. Now, Village MD. So this is again a good case studies where um, they are providing 100% care through virtual doctor visits. So during the COVID time, I'm sure they have started using Health Cloud and Experience Cloud to provide engaging with the high risk patients through virtual screening itself. Now, that was through a provider, but however, if you want to use it as a payer, now as a payer, if you'll be using as an insurance company, if you'll be using Health Cloud, so you need to make sure that that you are delivering personalized care or experiences to your patients who've been using your insurance, end-to-end member experience to be provided. What are the different plans which been into the market? Collaboration and automations and automate the operations and I mean somewhere you can sending certain messages to your patients where which can motivate and healthy behavior and from anywhere or everywhere. It's kind of a community kind of a thing. So these are and then everything is under the trusted and secure care of trusted stamped of Salesforce, which is HIPAA compliant and access control, encryption, decryption. So again, as a pair, you can provide personalized contact center experience. You can also provide member care management. You can also Medicare Advantage skills and administration, and you can provide a provider network. You will also have, right. You can create your own provider network. Now, if we look at from the payer side of it, the insurance company side of it, definitely it will be contact and inquiry management, outreach and marketing, which is through the marketing cloud. Identity verification, whether the person who is taking the claim is the same person or not. Then omni-channel and providing self-service to these clients as well. Renewals and re-verification of their insurances, and then customer 360-degree and the collaboration. So as a single view of all the members who've been part of your insurance, then providers who might be sending e-claims, then the partners who might be helping you as providing more members or providing more help. I mean, it could be technicians, it could be any other person who's a partner there in this as a payer. Now, again, under that, if you as a payer you've been using it, then you'll be connected with pharmacy. You will be definitely sending your e-claims. You will be definitely being connected to devices or clearing houses or EMR or EHR systems as well. Mhm. Now, Humana, which is again insurance company, a big insurance company, been using Health Cloud of Salesforce. A lot of, I would say, a lot of clouds they've been using. They are using Service Cloud, they are using Marketing Cloud, they are using Health Cloud, Commerce Cloud, Analytics. They are using Platform also, then Industrial Cloud, other industry cloud integrations, which is through MuleSoft, then your partner in securities, right? Now, the main part was, providing certain good relationship with their patients, basically with regards to coordination, with regards to home care, contact center, omni-channel presence, self-service portal, and whatnot, basically. Then Clover is again providing care to their providers and members, and 2,000 members receive mail delivers delivery meds. So they've been using Health Cloud and Experience Cloud and Marketing Cloud. Then Community Health Choice, they've been using Salesforce for sales marketing, Health Cloud industry and partners. So basically connected to 60-degree member view they're providing. So I'm just going through few of the case studies. Horizon is again one of the pair which is providing, high value based model to their patients, basically the care management, and they've been using partner community as well as Health Cloud. Blue California, then which is using sales, service, marketing, and Health Cloud and providing product catalog, care plan, then enrollments, renewals, all on Salesforce. Now, think yourself as a pharmaceutical company, whether it's an API, CRAMS business, or because in pharmaceutical, again, you have different businesses. You can streamline your patient engagement process. You can drive patient service through collaboration. Then you can have surface proactive data-driven insights can also be provided, right? Now, as a pharmaceutical company, then you will have connected patient services, accelerating R&D innovations, and personalized medicine. So contact and inquiry management, onboarding enrollment, patient scheduling, pre-post activity management, patient and caregiver experience and adherence support. I'm just taking to the next screen. Novartis Pharma, then they've been using Salesforce and huge on Health Cloud marketing integrations with MuleSoft and whatnot. And a lot of good numbers, I can say, 3x of the faster setup for the new care plan templates, 88% configurations with minimal coding. Yeah. MGen is again using almost all the clouds of Salesforce and invest heavily on employee experience with customized intranet being built on Salesforce. They also providing digital experiences to their employees. So MGen is using Salesforce. Then Otsuka is again Genesis Pure Connect integration they have done, and they've been using Marketing Health Cloud and Experience Cloud. Yeah. Then, if you are a medtech company like Preston Care of the world, then you can improve your sales cycle using Salesforce Health Cloud. You can also have commercial planning insights. You can also have your patient connections also, right? Now, as a medtech company, I would say that you can make your virtual sales. You can have highest customer retention and satisfaction, intelligent field inventory management, or commercial operations. If I look into this screen, then as a medtech company, you will have members, you will have pre-sales, you will have sales activities, you will have account planning, you will have post-sales exercise also. Now you're as an edtech not edtech, sorry, a health tech company or medtech company, you've been connected with pharmacy, again, claims, devices, clearing houses, and EHR or EMR. There are a lot of jargons which I've been using in this. It is all because these jargons been used in this, like example EMR, EHRs. These been used into the um, Salesforce in Salesforce, especially in the US market, healthcare market, and that's why my slide is a little inclined towards that. Now, as a Smile Direct Lab, so they've been using 360-degree patient view with the help of marketing health platform, analytics, and bots and automation. They omni-channel presence they have given to their patients. Then Ontario, which is again using MuleSoft and Health Cloud, then Shield, strategic partnerships, then Tableau, all that. So been using Salesforce. Then she's using again nationwide vaccine management platform they have, and they've been using it on Salesforce. They went live in 2 weeks with partnership from IBM and Experience Cloud, Health Cloud, Service Marketing. A lot of clouds they've been using. Then again, this so some of the companies, the public domain companies, been using vaccines, distributing the vaccines. So public health and wellness. So they've been using Salesforce, and the system went live in 4 weeks through. And I mean, they've been distributing vaccines more efficiently and more faster with Salesforce. Now it is a basically tailor-made for you because it is compliant, conformant, and certified, and then it's part and parcel of sales and service together. And you can do a lot of customization and configurations, and your time to value. I mean, you can easily customize it in a lesser time period as compared to even other clouds of Salesforce. And that's how your EHR and Salesforce being connected you will have customer 360, omni-channel presence, call scripting, and intelligent services. So you will have more and more details of your health cloud, and which is connected with your EHR. And that's how my screen is. I think I completed on time, but I'm just left with very less time. I'm so sorry. To showcase the demo, I'll just go to Health Cloud login, and it is as simple as you log into the sales. I logged in as one of my, let's say, the role is the Kansha Kapoor, and she logged in, and through which you have different applications. There are different applications on Salesforce, and when you have different applications on Salesforce, whether you've been going under the home health or field service, guest management, you also have referral management here. Then Health Cloud Learning app, then intelligent sales, which you can do through this, your social determinants, then your service console, then your data analytics. All these are the applications which we have created for different roles. And let me just go one by one. That's my Health Cloud. So there will be a home page, there will be accounts. Under accounts, you will have all your accounts, which is your payer account. So if you want to create, so you will have all the household accounts, your business account, your individual patient accounts, your payer account, and your personal accounts as well. Now you can see all the accounts here. Now these are your patients, customers, patients and customers. So or some of them will be hospitals. So if I'm going to any of the hospitals, then I can see the contacts under that. I can see the opportunity which could be running with that. The details about this hospital, it would be there. Then if I want to see how much of the business, which I want to do with them, I can see, what market growth they are growing at. So I can, based on that, I can bring my, based on that, I can bring my forecasting and my account relationship in this account. So this particular hospital is connected in in this facility there are the certain providers and different other accounts as well, so I can showcase the account relationship within this account as well. Now, under these sales, there are a lot of things which is there. Then you can make your visit plans also. So when was the start time and end time, and your visit planning as a salesperson you can have. So under this visit, what kind of a visit is a surgical visit or special instruction, which particular account you are going to as a salesperson, what all products you've been carrying, and there is again any task, journal visit, task or visitor whom you are meeting there, visited parties, so this is a visits. What are the as a company, what all product and services do you have, that is will be listed over here. Then you can also define your locations so that when you're visiting a particular location, then within that location you can meet with different providers or payers there itself. So that is also been possible here, right? So basically, with regards to the sales, you will have your visits planning, your complete visit planning, and complete account 360-degree information there, and with all your products and work types, right? Yes. Now, there is one more, as I told you, because if you want to do a research, searching a particular provider, you can also search a particular provider here. Let's say, I will say from 50 miles from here, and from different specialty, not here, then I will say any. Yeah. Okay. Let me just go here and then try one search criteria. They are saying, if I will have the data into it, yes, it will start coming in. That's how your providers would start coming in, and you would be able to know their details also, right? So that's the provider search there. All the contacts would be there, the intelligent view that this is a particular contact which you have Charles Green, no activity been done, and no upcoming activities with them, which account it's linked to. If you want to take a certain action, that you want to call them or do something else, get survey invitation, you want to send a survey invitation to them after your meeting, you can. So a lot of things, I would say, been there. So this is one of your personal account. You want to do a better search over there. They know how many beds would be there, any specialties, subspecialties, what plan would be there, facility name, facility address, distance from you, like, and then you can do your search after that. Yeah. Then after this, yeah. There is a cases also complaints which been logged by your patients or anyone else. Those is again a service thing which I think needs to be taken care of by uh, you know by your customer care team. So once again, there's a homepage where, as a sales, when you look into it, you have different type of accounts. Now your accounts can be a payer provider, household, or a business. And then when you get into these accounts, you will have certain details that, if it's a B2B account, you will have contact opportunities running your partners against that, more details about it. Then you can also do a forecasting of these accounts based on the relationship you will have in these accounts. That is also been possible. Then, as a sales, you can make your own visits and you can plan your visits, and you can go there and what all tasks you have planned in these visits, who all you're visiting, and can be done. You can make locations, product, and everything. As a B2B sales company or B2C patients, which is coming through these referral providers. Then care coordination is all about your patients and the kind of patients you have, and then you go to these patients and have complete patient navigation, patient history over here, patient card, and those details. See, immunization, medical procedure, care request, which been given to these patients. The complete card is on the right hand side. Then what actions to be taken, timelines. This is the data. When did you make a call? Past calls. Then activities which been done. Chatter is, you must be knowing it. Then the clinical data of this patient, patient account details about this patient, then the care plans of this patient, because what kind of a care plans from which payer they have, so these kind of plans they have, and unified health score. So that's how, this is what current score is here. Previous score was 2, so it's been increased. Adherence score, clinical score, social score. Uh, then what kind of a medications he's into. This medications is being he's taking. Then this one, then this one, you can add a request. Let's say he wants an insulin. I can new medication request to be given. Now, that's more than any social determinants could be there. The lack of transportation, need a visit to this, safety, under safety, food and finances. Then I can also have, let's say, schedule an appointment if there is there any appointment which schedules Monday, Tuesday, Wednesday, the time, at what time, the and which provider they want to schedule an appointment. The relationship of this is with Charles Green household, then Amy Huffman, then these care plans, then against these two accounts also, that's the relationship they have. And any device data which is coming from monitoring, that can also be taken care of. So that's pretty much from my side. So is a learning, health cloud learning, provider, payer, and medtech and farmers. Yes. So this is pretty much from my side. I think if in case you have any questions, you can please shoot your questions to consult at folio.com, and I will be able to help you over there as well. Thank you so very much.